What actually happens to the vagina if someone is not having sex? Now, people can decide not to have sex for different reasons. Some people, for religious reasons, they are unmarried, so they don't want to have sex for religious reasons. People just want to be celibate and they have their reasons for doing that. For health reasons, just so many reasons why people can actually decide to not have sex. But are you curious to actually find out about the vaginal health? What happens to it? So, whatever the situation is for anybody, I'm going to explore what actually happens to the vagina if it happens that you are not having sex. Hi guys, welcome back to my YouTube channel. My name is Melody and I'm a registered nurse. The vagina is a muscular wall that connects the external genitals to the cervix, which is the lower part of the uterus. So it is through the vagina that the fetus passes through during childbirth. And when a woman is menstruating, the menstrual blood will also flow through the vagina to come outside and also for sexual intercourse. So these are the three main functions of the vagina. One major key player in the maintenance of the vaginal health is estrogen. Estrogen is a hormone that is produced by the ovaries in women. Now, the estrogen is what will help the vagina to be thick, to be elastic, and to be lubricated. But now, what happens if someone is not having sex? What happens to these three factors that is helping the vagina to stay healthy? Lubricated, elastic, and thick. What happens if you are not having sex? Is this whole system still going to stay or not? First, let's talk about the elasticity of the vagina. So, what this means is that the vagina is able to expand and comes right back to the normal position where it was. So, that is the elasticity of the vagina. Like I mentioned, the estrogen is part of the things that helps the vagina to maintain that state where it is able to stretch and also come back to that position. It is because of this elastic nature of the vagina that is why someone is able to have sex, because that's the ability to expand to accommodate the penis. It's also why it is able to help for the passage of a baby. So that is the elastic nature of the vagina. And now estrogen is what helps the vagina to maintain that elasticity. So for women who are premenopausal, that is from women who have started menstruating up to menopause, estrogen is constantly produced by the ovaries, which means that if you fall within this age group, whether you're having sex or not, your ovaries will continue to produce estrogen that will help to maintain the elasticity of the vagina. Still on the issue of elasticity, like I said, the vagina is a muscle, and just like many other muscles in the body, regular use of those muscles help to maintain their strength and elasticity. So that is what also happens to the vagina. If someone is having regular sex, they are more likely going to have more elastic vagina than someone who is not having a regular sex. However, in some circumstances, loss of elasticity can also happen if a woman has had a difficult childbirth. They can temporarily lose elasticity of the vagina. And also, if women get to the menopausal stage where the level of estrogen has drastically dropped, the vagina tends to lose its elasticity. So to answer the question, if you're premenopausal, that is, you haven't started your menopause yet, that means you are producing estrogen that is going to help to maintain the elasticity of the vagina. But if you are concerned about not having sex and losing the elasticity of the vagina, you can do Kegel exercises. They are very helpful in maintaining vaginal elasticity. And this also applies to postmenopausal women who are concerned about loss of elasticity, because this is very common with a drastic drop in estrogen, which happens after menopause. Another thing people are also concerned with not having regular sex is vaginal lubrication. So people are concerned, is the vagina going to dry out completely if someone is not having regular sex? Now, on a normal day, for a healthy person, you will see that the vagina has its own discharges. So these discharges is what helps to keep the vagina moist, clean, and protected from infection. Now, the consistency of the vaginal discharge, you will notice is that it changes during the month, depending on where you are with the menstrual cycle. And this is mostly, again, controlled by estrogen. So for premenopausal women, they are also able to have their vagina lubricated throughout the month because there is constant release of estrogen. Now, again, this might be different for women who are menopausal because estrogen has drastically dropped, so they may have more vaginal dryness. During sexual intercourse, when a woman is aroused, there's like the whole system where the nervous system sends signals to the brain. There's vasoconstriction, so the blood vessels around your vagina becomes constricted. There is an increased blood flow to them as well. So those fluid will seep out into the vagina, which is what helps to actually lubricate the vagina during sexual intercourse. This whole thing, this whole system of lubrication during sexual intercourse only applies during sex. If you are not having sex, your normal discharge will continue, and then it's the same for people who are actually not having sex. So, difference actually with people who are having sex and people who are not, in terms of the vagina, I think is mostly with vaginal elasticity. So, if you're having regular sex, we are premenopausal, you are going to have more elastic vagina than the person who is not. However, for people who are not having sex, it's not a difficult thing to make your vagina elastic. You can do exercise, and once you start having sex again, if for example someone was abstaining for some time, if you start having sex again, it's usually not a concern. It's not something that you wouldn't really easily return back to normal if you start having sex. Also, if you have been out, if you haven't had sex for a very long time, you're a bit more uncomfortable the first few times when you try to have sex again. So that is it for elasticity and lubrication. So there you have it. Those are like the two areas where you actually see a difference in people who are having sex and those who are not. And if you ask me, there's not really any much difference like that. So if it is something you choose not to do, it is perfectly fine. You are healthy and you are okay. So thank you guys for watching this video. Please make sure you subscribe to my channel and let me know what you think.